Thank you very much, Presiding Officer. This Parliament's Finance Committee called for updated costs of the SNP's controversial plans for a centralised care service to be given to them this week. Humza Yousaf's government have refused. The last estimate for the centralised care service was £1.3 billion. But after that figure came out, Audit Scotland said this: "It is likely that the overall cost of the measures will be significantly above the amounts currently assessed." So will the First Minister tell us now, how much is this really going to cost Scottish taxpayers?
First Minister.
Well, first and foremost, Presiding Officer, let's not forget why, of course, we are introducing and have introduced the National Care Service legislation. It's to end that postcode lottery of care that we all accept exists right up and down the country, that inconsistency of care that has existed. We want to introduce a system that ensures that we put fair work principles at the very heart of the National Care Service, that we put those who need care at the very heart of a National Care Service. What I would say to Douglas Ross is, of course, and I think opposition quite rightly have asked for from the Scottish Government, is to ensure we engage with local authorities, to ensure we engage with our trade union
First Minister,
colleagues.
sorry, just before we go any further, I would be grateful if members could treat one another with courtesy and respect. First Minister.
It's hardly a surprise, Presiding Officer, that they groan when I mentioned fair work principles and working with trade union colleagues. What I would say to Douglas Ross is he was one of the first to call for us to pause the National Care Service legislation so that we do engage with local governments, so we do engage with trade unions. We are doing that in order to hopefully find a level of compromise in the National Care Service legislation, which will allow us to take that forward with hopefully an element of consensus. Now, depending on what that compromise is, of course, we'll then determine whether there's any changes to a revised financial memorandum. So once we've had that engagement intensively over the course of the summer, we'll return to the Parliament and ensure there is a revised financial memorandum.
Douglas Ross.
The muted applause hasn't got any better from last week, and it's no wonder, because the answers haven't got any better either. The First Minister is suggesting there may be additional costs. Audit Scotland were very clear. The £1.3 billion cost is not going to be the final cost. It's going to be higher. And it turns out, from that feeble answer that didn't address the point, the First Minister has no idea what it's really going to cost. He is throwing public money away when frontline social care services are in desperate need of more funding. The SNP could be investing to improve these local services. Instead, they are creating a bureaucratic nightmare and want a blank cheque to do it. Already, the SNP have wasted £14 million on this plan. They've spent £1.9 million on consultants. But the plans are not advancing, there are no signs of progress, and the legislation has been repeatedly delayed. So, is the First Minister paying consultants a fortune to tell him what everyone else knows? His plans are woeful and they won't work.
First Minister.
It is hardly a surprise that a National Care Service plan that puts fair work at the heart of it, that puts sectoral bargaining at the heart of our plans for National Care Services, that puts ethical commissioning at the heart of our National Care Service, is wholly opposed by the Conservative Party. Hardly a surprise to anybody in this chamber, hardly a surprise to our trade union colleagues, and hardly a surprise to the people of Scotland. And in all of that, why are we bringing a National Care Service forward? We're bringing it forward because we know of the extreme challenges that are faced by those working in social care because of workforce. We know that is the biggest challenge that is faced by social care providers. And of course, one of the fundamental reasons for that workforce challenge is the hard Brexit imposed upon us by a UK government. So once again, the Scottish Government is having to pick up the pieces.
Thank you.
Once again, the Scottish Government is having to mitigate the woeful decisions made by a cruel Tory government. And how are we doing that? Yes, we are, of course, committed to spending the National Care Service, but we've also made sure that there's an additional £100 million to provide that pay uplift from April of this year. This represents a 14.7% increase for these workers in the last 2 years. I was proud to make, when I was Health Secretary, to make sure that there was not just one, not just two, but 3 pay uplifts for our adult social care workers, and we want to go further where we can. So we have committed to invest in social care right now to undo some of the damage done by the Conservatives' hard Brexit. And at the same time, we are absolutely committed to our plans for a national care service that will ensure fair work is at the very heart of any future care service.
Douglas Ross.
You wouldn't have guessed it.
Thank you.
You wouldn't have guessed it from that answer, but it was actually a question about spending almost £2 million on consultants on this proposal that the First Minister failed to address in his answer. But these plans are such a mess that his Social Care Minister, Marie Todd, who sat in the chamber just now, said this week. It's been a little bit hard for me to get my head around. A bit hard for the Minister in charge to get her head around. First Minister, she's talking about your plans. Because before Humza Yousaf failed upwards, he was not just the Health Secretary, he was Cabinet Secretary for Social Care. He wrote these shambolic plans. So what does it say about the First Minister's policy if his own Care Minister doesn't understand it?
First Minister.
It just goes to show how desperate Douglas Ross is when he starts with the personal attacks on me or indeed any of my colleagues.
Thank
not
you,
on the policy,
members.
not on the substance, on the personal attacks from a man who is, of course, the least popular elected politician on these islands by any poll estimation in the entire country. Oh, and the best retort Douglas Ross has is I'm catching you up. You're still the most unpopular leader, elected politician in this country by quite a country mile, presiding officer, or Douglas Ross is. On consultancy spend, because it is an important point, of course, the Scottish Government and our officials are absolutely focused on making the National Care Service work. But it is, of course, important that we bring in those additional technical and specialist expertise that allows the Scottish Government to ensure that we make progress on the legislation itself. And in terms of the finances around the National Care Service, which is a very legitimate question, I've said, of course, we will engage with trade unions, engage with local government, and hopefully, when we reach a compromise position on the National Care Service, we'll come back with a revised financial memorandum. But I'm hardly going to take, and neither will any of ministers in my government, take any lectures on financial literacy from Douglas Ross, who demanded that this government copy Liz Truss's tax cuts, which would have cost the Scottish Government £500 million and caused economic carnage to our Scottish public finances.
Douglas Ross.
This is absolutely hopeless from the First Minister. He said it was a desperate tactic by me to quote his own minister. And listening to that answer, I'm pretty sure Marie Todd still can't get her head around the policy or the costings, because it's quite clear the First Minister can. This is all starting to look like another Humza Yousaf disaster. The man who couldn't get the trains to run on time, forced police officers to breaking point and left our NHS in crisis is now doing his best to throw social care into chaos as well. He doesn't know if he's building a national care service or a white elephant. Humza Yousaf has no idea how much this centralised care service is going to cost, or when this bureaucratic nightmare will be ready, or how it will improve the situation for people who desperately need better care. The last thing, the very last thing our struggling care service needs is an administrative overhaul costing billions of pounds when it's being starved of cash from the front line. So will Humza Yousaf do the right thing, stop wasting taxpayers' money and scrap these plans altogether?
First Minister.
Quite incredible, presiding officer, that when we have given a pay uplift to adult social care workers, Douglas Ross describes that as a waste of money. Because every penny we spend on social care is ensuring that we lift standards for adult social care workers, ensure we're lifting standards for those who are in receipt of care. And while we do that, yes, build a national care service that has fair work at its heart, that builds a national care service that has ethical commissioning at its heart, so that the profits from care aren't just gleamed away into bank accounts in the Cayman Islands, something, of course, the Conservatives would like to see. a national care service that makes sure we put sectoral bargaining at its very heart. That's what we are committed to. And all of that, of course, in the midst of the fact that we've had over a decade of austerity from Douglas Ross's Conservative, that we've had a hard Brexit imposed upon us, and of course the disaster of the mini-budget, which, if we had listened to Douglas Ross and gone ahead with tax cuts for the wealthiest, our budget would be worth £500 million less. So I'll take no lectures about financial literacy, nor indeed for standing up for those who are working in our care service from Douglas Ross or the Conservatives.